Hello, hello, hello. I'm back again. I'm Liz. My name is like this, Liz. I'm a public health graduate student, and I wanted to show you guys all and tell you guys all about my studies, tell you about my graduate program in public health. This is my second week of school, and this week what I'm studying is here in Florida, my home state. I live here in Florida. And here in Florida, we have a disease outbreak of measles that happened, just happened this year in 2024, just in February. In February of 2024, we had measles disease outbreak here in an elementary school that happened. That was called Manatee Bay Elementary School that had that disease. There were 7 kids involved in that outbreak of measles. Wow, that's surprising, right? Why didn't they have the vaccine? Why didn't they have the vaccine? Don't we have a vaccine for that? Didn't they get it when they were babies? And now they became sick. So some kids don't have that vaccine. Some kids never experienced that vaccine before. Their parents decided, oh no, we don't want that. I don't want my kids to get that vaccine. Why? Why not? Why wouldn't you want that? That's called vaccine hesitancy. That means, oh, yeah, I don't know. I don't want that. I'm against that vaccine. Maybe, I don't know. I don't want that. I decide I don't want to get that vaccine. Or the parents decide that they don't want to get that for their kids. So in that elementary school, there were 7 kids. And then outside of the elementary school, there were 2 more kids that became sick, younger kids who had not yet started elementary school. So altogether, 9 kids became sick with measles. That's interesting. That's an interesting story, yeah. But the most interesting thing, our Florida Department of Health sent out a letter. Sure, probably telling the parents that it's important to go ahead and do it, get the vaccine. But that didn't happen. The Department of Health said, well, it's up to you. It's your choice. You can decide if you want to get a vaccine or not. That's strange. That's a strange decision. Why would they do that? Why would they not encourage parents and tell them it's important for their kids to get the vaccine? The Department of Health, that's their job. That's their responsibility to tell parents, encourage them to go get the vaccines. Scientific research supports vaccines. Why wouldn't you tell parents that it's important to get vaccines for your kids? It's really interesting that throughout America, more and more parents seem to be resistant to vaccines. Some parents decide not to do that because they believe that the vaccine is related with autism. Is that true? No, that's not true. That's not true. But some parents do believe that. That's true. Yeah. Another reason why people maybe don't support they don't want vaccines for their kids because maybe they don't understand. You want to give a vaccine to my baby? No, I don't know. I don't want that. But it's important. It's important to get the vaccines. Our responsibility in public health, we know a lot about vaccines. We understand a lot about that. And so our responsibility is to encourage people to become involved in the vaccine program, become involved, get the vaccines for their kids. Research is going to be posted underneath this movie down in the description. That's from Coleman and Meyer in the year 2024. Their study is related to vaccine hesitancy. Their results showed throughout the United States, many different states have vaccine hesitancy increasing. Many different states have that happening. The worst states had an increase of 3% in 1 year, increased 3% more people were resistant to vaccines. The research from Scyther in the year 2023. That's interesting. Why would people be resistant? they tend to be scared and worried. I'm a mom. I worry about my baby. I cherish my baby. I try to do the best care possible that I can. And that means that maybe when there's a decision, it's difficult to make. I don't know what to do. Some person's telling me, oh yeah, get the vaccine. It's important. It's required. And other people are telling me, oh no, that's bad. It's dangerous. The vaccines are dangerous. And now I'm a mom. I care about my baby so much. What do I do? And I don't know. I don't understand. I don't know why it's important to get the vaccine. Maybe I'll be scared. I'm a mom. I have 2 kids. I do. And I want to take care of them in the best way possible. And so maybe I'm scared. I want to pick what's right. That's scary. It can be. So recently, in my experience, I have a college class called microbiology. And I was sitting in that class and watching the lecture. And another person, a student in the class, raised her hand and she said, my experience recently, I was pregnant and the doctor told me that I had to get a vaccine. And I said, no, I'm proud of that. I said, no, I don't want that. I'm proud. And me, I was watching that student and I thought, what? Why are you proud of that? Why are you proud that you don't want a vaccine? This is a microbiology student. That means she wants to become a nurse. But she's suspicious about vaccines and she doesn't want it? So is she going to give other people the vaccines if she doesn't want them herself? If she doesn't understand why they're important? That's the same. She's scared. Maybe she doesn't understand. Oh, yeah, if I didn't understand and I didn't know why that vaccine was being given to me, maybe I wouldn't want it. But myself, I was looking at that person telling her story, and I was thinking about later when she becomes a nurse, she might care for my children, my grandchildren later. That woman might be caring for my kids. Do I think she's going to take good care, give skilled care? I don't know. I want to feel confident in my nurses and my doctors, but now I'm looking at her and now I'm scared too. So my research, I was researching more specifically related to that Manatee Bay Elementary School, researching why maybe they would have more hesitancy in that school. Is it because that school is more poor? No, that school's economically disadvantaged number is 18%, just 18%. Is that a high number? No, that's 18%. That means, is that a poor school, that elementary school? No, it tends to be more like normal, you would say normal financial situation in the families in that school. Maybe their students have good skills in math. I researched the scores for that elementary school. Maybe they have bad scores. No, they have good scores. Their scores, math scores, 73%. Successful in math compared with the state scores for math tend to be 47%. That elementary's reading scores, 81% compared with the state average is about 49% for reading scores. So one thing I noticed was that the minority in that school was a high number at 78% of minority students, minority people in that school. That means maybe, I don't know, I was suspicious maybe there might be a language barrier they're not understanding. Maybe the nurse is putting out information, sending home related to vaccine. Maybe if my experience is that English isn't my first language, then I don't understand that content that's being sent home. Might that be a reason for a vaccine hesitancy? Maybe. That information is from U.S. News and World Reports 2024. So that minority maybe means a language barrier is possible. What's another reason? Maybe like calling the doctor, getting a schedule call. I don't understand that. Like the doctor's telling me, hey, your appointment's coming tomorrow, and I don't understand that. Maybe I don't go to the appointment. Maybe I forgot about that appointment and because I don't understand the language. So that's possible. And maybe that culture doesn't accept vaccines. Maybe that culture tends to not accept vaccines. That could be possible too. So that situation is concerning for myself as a nurse. I'm concerned. Why would my state of Florida, our health department, why wouldn't they encourage people to get vaccines? And then something else happened recently too. About last month, had an email. I was reading an email that I received about the new COVID vaccines, that you shouldn't get that. And I saw that. That's from the Department of Health. They told me not to get a COVID vaccine. Why would they do that? The FDA says, yeah, it's safe. Go ahead and do it. But Florida says no. What? I don't understand. That's concerning for me. Yeah. So now I'm asking your opinion. What do I do? What do I do now? I'm curious. What's your opinion? Should I go ahead and get the shot? The COVID shot? I think yes. But should I tell my patients? What should I tell my patients? Yeah, go ahead, accept the vaccine, the COVID vaccine. Because the US says yes, it's safe. Or do I tell my patients no? Because Florida Health Department says no. Which do I do? What's your opinion? You tell me. I don't know what to do. I'm curious. What's your opinion? Tell me in the comment or give me a movie. I'm curious what your opinion is. So thank you. Bye. Thank you for watching. I love you guys. Please touch like.